everyone to another lecture which is about rectum and anal canal. The rectum is the pelvic part. You see here, it is the pelvis, and the rectum is the pelvic part of the digestive tract. So I prefer to explain it in the GI system. So it doesn't matter, but anyway, this is the rectum, guys, which is a continuation here of the sigmoid colon. You know, we have ascending colon, transverse, descending, and sigmoid colon, and from sigmoid colon, the distal continuation is the rectum. Where is that? It's exactly at the level of the sacral vertebra number 3. This is the sacrum. Look at this. Look at the curve of the sacrum. Anyway, this is the S1, S2, S3, 4, and 5. But anyway, at the level of S3, here is the connection between the sigmoid colon and the rectum. We call it recto-sigmoid junction. So this is the junction between sigmoid and rectum. Recto-sigmoid junction, which is at the level of S3 vertebra. That means we have to know where's the let us say the rectum started, and where's the end of the rectum. So as I mentioned, the rectum simply started in the front of the third sacral vertebra here, and it continues down until, like, say, this is the coccyx. That means this is the tip of the coccyx, but it continues just in the front of the coccyx, a little bit below, about 1 inch below the tip of the coccyx. That means it started at the level of sacral vertebra number 3, and it ends in the front and a little bit below the tip of the coccyx, about 1 inch below on the front of the tip of the coccyx. Now, let me give you just a couple of things about now you know where is the rectum, its continuation of what, and you know where it started and where it ends, right? So it started, you know, as a continuation of the sigmoid, and it ends at this level, 1 inch below the tip of the coccyx, and it continues as anal canal. This is about 1.5 inch, right? So, you know, maybe you have to know that the rectum is not completely covered by peritoneum. So we can consider it like, it's not totally, but it's a kind of part of it is a kind of retroperitoneal structure. Let me show you here. This is the sigmoid colon, and this is the peritoneum. Look at the peritoneum. Oh yeah, look at here. This is the rectum. We can divide it, let us say, to 3 parts. This is the sacrum, right? And this is the coccyx. Anyway, so at the level of S3, let us say this point here, this is the continuation of the sigmoid and the rectum. This is the rectosigmoid junction. At this point here start the what we call it, the rectum. So this is one part, and this is one, let us say this is the 1/3, and this is the 2/3, and this is the 3rd part of the rectum. That means we can divide it into 3 parts. Indeed, why I'm talking about this? Because I'm trying to show you the relation of the rectum to the peritoneum. So in the upper third, as you see here, in the upper third, it's covered from the front and laterally, as you see here, but it's reflected here and on the other side. That means the upper third of the rectum is covered like completely by peritoneum, except the posterior part, right? That means it's not covered by peritoneum totally, just the front and lateral. When you go to the middle 1/3 of the rectum, you would see that it's the peritoneum just covers the front of the rectum. This is just to make sure that you know what I'm talking about. This is sagittal section from the pelvis. Anyway, so in the middle third, the peritoneum just covers the front of the rectum, but then it reflected on the urinary bladder. This is the urinary bladder. That means the if you look at it here again, the peritoneum is not continue all the way down. It's reflected at this point. That means the lower 1/3 of the rectum is devoid of peritoneum. There is no peritoneum covering the lower 1/3 of the rectum. Let me show you here. Here's again what I talked about the peritoneum covering the rectum. So again, this is a frontal view of the rectum. Here is, if you look at this is the sigmoid, and this is the start of the rectum. Look at the upper 1/3 of the rectum, which is in which the peritoneum covers the front and the lateral of the rectum, but not posteriorly, right? But the middle 1/3, it's just the peritoneum shifted a little bit to the front, so the middle 1/3 of the peritoneum, just the middle 1/3 of the rectum, just covered from the front by peritoneum. Look at here, it's just from the front, so even it's not going to the back deep laterally, right? But that means here is the terminal end of the peritoneum, because I mentioned it's reflected in the base of the urinary bladder. That means the lower 1/3 of the rectum has no peritoneum, right? There is no peritoneum. Here is again, if you take a coronal section from the rectum, you see here is the peritoneum, my friends, in the upper third and middle 1/3, and it's reflected there. You see, and I think you can notice the lower part of the peritoneum, the lower part of the rectum has no peritoneum. Okay. General or couple of notes about the rectum. Again, this is the coronal section of the rectum, my friends, and you would see that this is the rectum. Let me show you, like here. There is the rectum, right? So the rectum piercing the pelvic diaphragm. Where is the pelvic diaphragm? This is the pelvic diaphragm that's represented by a muscle known as levator ani muscle. So this is the levator ani muscle that hangs down, and it forms the, what we call it, the pelvic diaphragm. And now the rectum, once it passes from this point, it becomes like continuous with the anal canal. Now, again, back to the rectum. Yes, this is the rectum, and the lower part of the rectum is like dilated, in which it's known as rectum ampulla or ampulla of rectum. Ampulla, it means, ampulla is something like dilated. You know the ampulla of a drug, like this? So it's dilated. So dilated part of any structure, like we call it ampulla. So this is the ampulla of the rectum. Now back, although it will be really would be covered like extensively in the urogenital system, but I would like to show you, here is the levator ani muscle that forms the pelvic diaphragm. Levator ani muscle is like 3 parts. The most medial part is known as puborectalis. This is the puborectalis that makes like a U shape. We'll talk about it, like U shape or sling around the junction between the rectum and anal canal. At this point, in which this sling or U shape, it creates a kind of what we call it, rectal flexure. Rectal flexure. There is a flexure. We'll show you. Where is it? Now in this figure, you see, my friends, as we talk about the general features of the rectum. Again, this is the sigmoid colon. Look at the sigmoid colon back again. You know the features of the large intestine include the existence of teniculi, as you see here. Also fatty, what we call it, epiploic appendices or omental appendices. It's a projection of peritoneal sac filled with fat. Plus, look at the hostria here, the circulation. So these 3 features, when you see them, you would say, yes, these are large intestine. Now, again, this is the sigmoid colon, and this is the junction of the sigmoid colon with the rectum. That means what I want to say that at the rectum, at the beginning of the rectum, or how can you tell that, yes, this is the terminal end of the sigmoid colon and the start of the rectum, by disappearing of those features. That means the tenaculi, look at the tenaculi, it becomes like it disappeared, and it kind of spread like around the rectum to form the muscular coat, the outer longitudinal muscular coat, right? This is adenocoli, and there is disappear or discontinuation of the omental appendices or epiploic appendices. There is no omental appendices or epiploic appendices in the rectum. That means there is no tenaculi, there is no epiploic or omental appendices, and there is no circulation. We don't have these things here, right, in the rectum. That means these are features of the rectum. Now, again, this is a sigmoid colon. Look at the junction. Start the junction between the sigmoid colon and the rectum for what we call it rectosigmoid junction. Look at the tenaculi. It starts to disappear, so it's not a band as you see here. Instead, the 3 bands of tenaculi that explained in a previous lecture, now they start to spread as you see here to form like the outer fibrous coat as you see here, right? So this is the outer fibrous muscular coat, and if you remove it, you will see internally you have inner circular layer, right? That means you have outer longitudinal, and it comes from where, and inner circular layer of smooth muscle. Now, as I mentioned before, 2 slides about the pupo rectalis and the anorectal flexure. That means before jumping to the anorectal flexure, so I would like to talk in general about all flexures of the rectum. So in this figure, my friends, you are looking to the rectum from laterally. This is a kind of sagittal or parasagittal section of the pelvis, right? So when you look to the pelvis laterally, you would see the rectum in this shape, which is like a shape. Look at the sacrum, look at the sacrum, look at the curve of the sacrum, look at the rectum that follows the curve of the sacrum. That means because of the existence of the rectum in the front of the curve of the sacrum, that means when you look to the rectum laterally, you get the anterior posterior flexures. That means you have a flexures, but they are anterior posterior flexures. That means when you look at it laterally, look, this is the sacral flexure. This is the sacral flexure. So the sacral flexure of the rectum, it follows the curve of the sacrum and coccyx, as you see here, and indeed it's concave anteriorly. Look at the concavity here. So it's concave anteriorly. So this is what we call it, the sacral flexure. Okay, now let me change the color. And now you have another flexure, but in opposite direction, which is the anorectal flexure. This is the anorectal flexure, in which it's about, look at the bending, it's like 80 degrees, right? It's about 80 degrees. So this is the anorectal flexure, or we call it perineal flexure, in which the junction of the rectum and anterior are about 80 degrees, created by the pelvic diaphragm. You remember the pelvic diaphragm that I mentioned earlier, and the puborectalis that's like U shape and pulls the area here between the rectum and anal canal, creates a kind of anorectal flexure. And in this case, look, this is the anorectal flexure. You can describe it from posterior or anterior, but you can say, yes, it's concave posteriorly, right? Concave posterior, or you can say convex anteriorly. It's up to you. I don't care too much about it. The most important is to know that the anterior posterior flexures, that means we have sacral and aerorectal flexures. But let us take a frontal view of the rectum. Let us say you remove the genitalia and the stuff there, and you look to the rectum from the front anteriorly, and you take a cross section here, right? Coronal section as well, to see the inside of the rectum from the front. So we have not anterior posterior flexures, we have lateral flexures. Although you look to the rectum anteriorly, but these flexures you see here are these flexures are what we call it lateral flexures, because the flexures like laterally. So you can see it when you view it anteriorly, and it created these flexures. Looking here, this is a kind of superior superior one, inferior one, and this is intermediate one. Anyway, these flexures are created by three internal enfoldings. That means a mucosal folds that covered a thickening of smooth muscle here, circular smooth muscle. That means there is a smooth circular smooth muscle here, thickened here and covered by a mucosa, right? Covered by mucosa. These are, because they are transverse in direction, we call them transverse rectal folds. Very simple. Rectal folds, yes, rectal folds, they are transverse rectal folds. We have three. We have two on the left and one on the right. So this is the rectal folds. I'm talking about rectal folds. You have one on the right and two on the left. What they are? Rectal folds. But I'm not talking about flexures. The flexures like opposite. Because of these folds, that means you have, yes, you have one transverse rectal fold on the right, but you have two flexures on the right. You have two folds on the left, because this is the left, two folds on the left, but you have just one one fold or one flexure on the left. So let us again organize what I'm saying. This is again the left. So this is, you look to the rectum from the front and you have mucosal folds. We call them transverse rectal folds. These transverse rectal folds, you have three, one on the right and two on the left. They are mucosal folds covering thickening of circular smooth muscle, and that's it. And these folds, as I mentioned, yes, covering the circular smooth muscle. And because of that, you have two flexures created here, two on the right and one on the left. So you have this one, you have superior and inferior lateral flexure. On the other hand, you have intermediate flexure on the left. So the superior and inferior, they are concave to the left side, right? This is the left side. From left side, you see they are concave. Here, look, concave to the left side. But this one intermediate is concave to the right. I mean the concavity toward the right here, right? You can say it's convex to the left, but let us unite it to concave, right? So it's very simple. So these, let us say, these transverse fold, indeed, somebody can say, what's the function of these transverse fold? Well, indeed, it's believed that they exist to delay the passage of the stool and to fragment it, right? So, and also below, as we talk about these folds, below the last one, below this one, below the transverse fold. You know, the rectum now has a dilated part. This dilated part called ampulla of the rectum. So this is 1, 2, 3. So this is the area where we call it ampulla of the rectum. So that was about the lateral flexures and anterior and posterior flexures. Now, which is very easy. You have to know the relation of the rectum. And in this case, you are looking to the parasagittal view laterally of a male, in which the left pelvis removed, and you see here is the sigmoid colon, and here is the rectum. This is, my friends, the rectum. I will change the color. So again, this is, my friend, the rectum, in which anterior relation. What's located anterior to the rectum? Indeed, look at this pouch. Because of the reflection of the peritoneum, and I think we forgot to explain that. Look at the reflection of the peritoneum. We mentioned that the upper part of peritoneum and the upper third and middle third of the rectum covered, let us add, say, from the front of the rectum covered by peritoneum. So, but we know that the lower third of the rectum is not covered by peritoneum. Anyway, so the peritoneum reflected up on the base of the urinary bladder, and it creates a kind of a pouch. We call it, it's between the rectum and this physical structure. We call it urinary bladder. Urinary bladder contains urine. That means it's a vesical pouch. It's a vesical structure that contains fluid. We call it vesical, right? So this pouch is the rectovesical pouch between the rectum and urinary bladder. This is number one. So what's in the front of the rectum is the rectovesical pouch. Okay, you have also the base of urinary bladder, and look at the vas deferens that carries the semen, the sperms from the testis. So at this point, it comes like dilated, what we call it ampulla of the vas deferens. Ampulla, not of the rectum, ampulla of the vas deferens. This is the vas deferens, right? So it's dilated at the end. We call it ampulla of vas deferens. And also you have the seminal vesicle that creates the fluid of the semen. We'll talk later about it in the UG system. So you have also the seminal vesicle as well. And you have the, if you go a little bit down, what we have in the front of the rectum is the prostatic gland. So that's why the prostatic gland can be felt. We'll talk about it later. How can we feel the enlargement of prostatic gland and seminal vesicle through the rectum, right? PR test, right? You insert the finger from the anal canal and you reach here the rectum, then you feel it to the front. If it's like let us say if there is enlargement there, right, in the prostatic gland. And what we have also in the front of the rectum, you have the terminal part of the ureter, the terminal part of ureter. So these structures in the male are located anterior to the rectum. Again, you have the rectovesical pouch, you have the terminal part of vas deferens, what we call it ampulla of vas deferens here, and you have the seminal vesicle, you have the prostatic gland, you have the base of urinary bladder, and you have the terminal part of the ureter. So this is about the what we call the anterior relation of the rectum in the male. You remember maybe that the rectovesical pouch contains like the sigmoid colon. This pouch contains the sigmoid colon in the male and female, the same. Contains the sigmoid colon and coils of the small intestine and ileum, right? So in the female now, in the female, again, this is the sagittal section again of the sigmoid and rectum, my friends, and look at the reflection of the peritoneum that's reflected here between the rectum and what we have here. You have the uterus, and here you have the vagina. So yes, There is a urinary bladder like the male, but female, indeed, has vagina here and the uterus as well. So again, this reflection of peritoneum from the front of the rectum, upper part of the rectum on the uterus, creates a kind of a pouch again between the rectum and uterus. We call it recto-uterine pouch. Recto-uterine pouch, because between the rectum and uterus, recto-uterine pouch, which is the lowest part, we'll talk about it, the lowest part in the pelvic cavity, which is the location of the accumulation of fluid and infection. That's why it's important, and they call it pouch of Douglas. You have to know this name, pouch of Douglas. Nobody, I think, uses a recto-uterine pouch. They use pouch of Douglas. When you say pouch of Douglas, that means yes, it's been the rectum and uterus in female. That's fine. So again, it contains, as I mentioned, the sigmoid colon and ileum. And also, what's related anterior to the rectum in the female? Yeah, you have the vagina, but which wall of the vagina? Let me erase it and show you here. Again, this is the vagina, and this is the anterior wall of the vagina, and this is the posterior wall of the vagina that's reflected up. That means what's related to rectum is the pouch of Douglas and the posterior wall of the vagina. Posterior wall of vagina. Now, the posterior, that was about the anterior relation of rectum anteriorly in the male and female. Now, but let us have a look what's going on. What's the relation of the rectum posteriorly? Well, indeed, what's behind the rectum is the sacral bone and its related muscles, nerves, and vessels. This is simply so bone. You have the inferior from, because the rectum started from AC3, so you have the inferior three sacral vertebrae and the coccyx, and also you have a small vessel here, which is the median sacral vessel, median sacral vessels, and that's of course passes there. So let us say this is the rectum. Sorry, this is the rectum. So median sacral vessels, and you have the inferior end of the sympathetic trunk. The sympathetic trunk on each side here. So this is the nerves, and they create a kind of also sacral plexuses that comes from the anterior sacral opening. This will be covered in details in the UG system. And also, again, here's look at the opening. This is anal aperture, opening for the anus, and posterior to it, because the rectum will be here. So posterior to it, you have a ligament between the anal opening and the sacrum. We call it and coccyx. Sorry, we call it anococcygeal ligament. Anococcygeal ligament. Okay. Laterally, which is very simple. This is the again the rectum you see here. So laterally, it's related to levator ani muscle that forms the pelvic floor, and you have coccygeus muscle not shown here, but I think it's clear here. If say this is the rectum here, so laterally you can say, but anyway, coccygeus anyway located laterally to the rectum, and on each side look at the fat here. So this is a fossa here which is filled with fat. We call it pararectal fossa, which is above the pelvic diaphragm. Take care. So the pararectal fossa, para, that means on each side of that structure. Pararectal fossa, that means a fossa, this fossa on each side of the rectum above the pelvic floor filled with fat. So this is a pararectal fossa. So already I explained that, but it's good again to repeat it again and again when you talk about the reflection or the peritoneum in the male. And you see here is the my friends, the rectum, and you see in the upper third of the rectum, the peritoneum covers the front and lateral of the rectum, right? But not posteriorly. In the middle third of the rectum, the peritoneum just covers the front of the rectum, but there is no peritoneum in the lower 1/3 of the rectum. You see, because the peritoneum is reflected on the base of urinary bladder, creates a pouch between the rectum and urinary bladder. We call it rectovesical pouch, okay, which is a site of infection and a fluid collection, right? This is only just one pouch in the male, but in the female, again and again, the same. The upper third cover the front and lateral, but not posterior. In the middle third of the rectum, just the peritoneum covers the front of it. And look at it here. The peritoneum reflect from the rectum to the posterior part of the fornix of vagina. This is the vagina, right? This is the vagina, and this is the posterior fornix. This is the posterior corner, posterior fornix of vagina. So it's reflected on the posterior fornix of the vagina, on the posterior wall, and it continues on the rectum. So this pouch we called recto-uterine, between the rectum and uterus. Recto-uterine pouch, or the pouch of Douglas, which is important. Now, here's like the peritoneum, like, and the wall between the rectum and vagina. We call it rectovaginal septum, and it's like thin one. But anyway, the pouch of Douglas, look at it between the bladder and the recto-uterine pouch, or pouch of Douglas, between the rectum and uterus. Now, let us continue with the peritoneum that covers the uterus, and here is again reflected from the uterus to the urinary bladder, which is very simple to the male. In this case, we call it between the uterus and I mean similar to the male, not because the male has no uterus, but I mean it's reflected back again to the on the urinary bladder. Anyway, here is the between the uterus and urinary bladder. We call it vesico-uterine pouch. This pouch is the vesical structure. I mean urinary bladder. Vesico-uterine pouch anteriorly. That means the female has two pouches, right? Okay. Here is again give you just a simple idea about the puborectalis muscle and pelvic floor. This is the what we call it the pelvic floor from the muscle you hear, which is known as Levator ani muscle. 3 parts. The most medial part in purple color here is the puborectalis muscle. Puborectalis muscle from the attached. It's like U shape as you see here, in which it encircles back to the anal canal. Look at it here. It's like U shape back behind the anal canal at the junction between the rectum and the anal canal. It creates a kind of anorectal junction. This is the anorectal junction, in which look at the angle, which is about 80. It's a play. The puborectalis muscle is important because by this flexure it creates a kind of a major role in the maintaining of fecal continence, right? Preventing like the stool from losing down, right? By this sling that you see here. When you come, my friends, to the arterial supply of the rectum, and not just arterial supply, I mean the blood supply of the rectum, including arterial supply and venous drainage and lymphatics as well. So let us start with the arterial supply of the rectum, which is very simple. You have superior, middle, and inferior rectal artery. We mentioned that the rectum divided into 3 parts, right? Upper 1/3, middle 1/3, and lower 1/3. Anyway, the superior rectal artery you see here, in which it is a branch, if you remember, of the inferior mesenteric artery. You remember the inferior mesenteric artery that gives the left colic and the sigmoidal branch, and its terminal will be the superior rectal artery. This is the superior rectal artery that supplies the proximal, mainly the proximal part of the rectum. Now, let us talk about a little bit about the middle rectal artery. That was about the superior. Now the middle rectal artery from both sides, that means you have just one superior rectal artery, right? Because it's a continuation of the inferior mesenteric artery. Now when you talk about the middle rectal artery, that means you have two middle rectal arteries, one on the right and one on the left, and they are a branch of internal iliac artery. You remember the common iliac artery that gives the internal iliac artery and external iliac artery. From the anterior division of the internal iliac artery, there is a middle rectal artery on both side that supply the middle part of the rectum and the lower part as well. So the middle rectal artery or arteries supply the middle and inferior part of the rectum. Now, what about the inferior rectal artery? This is the inferior rectal arteries, one on the right and one on the left. They are a branch of internal pudendal artery, and the internal pudendal artery is also a branch of internal iliac artery. That means the middle rectal arteries and in the inferior rectal arteries, ultimately they are a branch of internal iliac artery, regardless if it's directly like middle or indirectly through the internal pudendal artery that gives the inferior rectal artery. The inferior rectal artery, as you see, it gives like a small contribution to the lower part of the rectum at the let us say anorectal junction, and it supply the anal canal, as you see. Okay, that was about the arterial supply. The venous drainage is very close to the, or it's corresponding to the arteries. You remember we have superior, middle, and inferior artery, and also we have the same superior, middle, and inferior rectal veins. The superior rectal vein, as you see, let me change the color. The superior rectal vein, I will change it to this. The superior rectal vein, indeed, it carries the blood from the upper part of the rectum, or it drains the blood from the upper part of the rectum up, and it continues as drain into the inferior mesenteric vein. You remember we have the inferior mesenteric artery, right? Here we have inferior mesenteric artery, and also we have inferior mesenteric vein. This is the inferior mesenteric vein, that in which the superior rectal vein, it drains the blood there, and the inferior mesenteric vein, it ascends up, then it joins, the spleen. Yes, you have a splenic vein. So the inferior mesenteric vein joins the splenic vein, then the splenic vein joins the superior mesenteric vein, not inferior, the superior. The splenic vein joins the superior mesenteric vein behind the neck of pancreas to form the portal vein. That means the upper part of the rectum, the blood from upper part of the rectum, it drains into portal circulation, then to the liver, right? But now the look at here now to the middle rectal vein, in which it is drain the blood into internal iliac vein. We have internal iliac artery, and also we have internal iliac vein. So the middle rectal vein, which is similar to the artery, it drains into the internal iliac vein, and also if you see here, the blood from the lower part of the rectum and anal canal here, guys, also you see drain into inferior rectal vein. We'll talk about the anal canal in details, but for now this is the internal rectal vein that it drains into internal pudendal vein, then internal pudendal vein into internal iliac vein, and internal iliac vein then it united with external to form the common iliac. That means the lower part of rectum here, it drains the blood into systemic circulation, while the upper part of the rectum drains the blood into portal circulation, right? So the nerve supply was pretty simple: sympathetic and parasympathetic nerve from the inferior hypogastric plexus that's formed there. We'll get more details in the UG system. And what I want you guys to know that the rectum is sensitive only to stretch because it's a visceral structure, and innervated by visceral nerves, inferior hypogastric plexus. Now, the lymphatic drainage, as I say always, the lymphatics in the deep structures follow the arteries. And you know that the upper part of the rectum, blood supply drains the blood supply into inferior mesenteric. The blood supply from inferior mesenteric artery, right? And the lower part of the rectum, the blood comes from the internal. Look at the internal iliac artery here, right? That gives the middle and inferior rectal artery. That means the lymphatics drainage will follow the arterial supply. That means the upper part of the rectum drains ultimately into the inferior mesenteric lymph nodes, while the lower part of the rectum drains the lymphatics into internal iliac lymph nodes, which is very typical and similar to the source of blood supply.